So we're ready to get started. I always like to start off with talking about, what we're going to discuss today. And today it's how DCI can help you train and empower remote employees during, the pandemic and moving forward afterwards. So what we have on today's agenda is talk about, who is DCI? How can a business management platform really help? Have a discussion of training and employee management. How does DCI fit into this? We're going to do a lightweight demonstration of DCI for you, showing off our mobile app with a EVV entry as well. And then have a discussion kind of everything we talked about today on how we manage remote employees with our time and attendance, training and messaging. Wrap it up with a Q&A and of course that $100 Amazon gift card. So we're excited about this and we're ready to get started. So I'm going to hand it over to Marisa to talk about who we are.
Thank you, Brian. I just want to give a brief introduction to those on the webinar call from DCI today. Something that you might not know is that about 80% of DCI's employees actually come from the provider side. And so for today's call, we're going to start here at the top with our COO. Our COO, Mindy Mitchell, spent 19 years on the provider side and was at the VP level before coming to DCI. She was working at an agency that was in multi-states and offered multiple lines of services. Brian Perry, our Vice President of Sales, he also has 9 years of IT healthcare experience. And I'm Marisa. I also have 17 years of industry experience, having worked on both the provider side as an HCBS manager, as well as the managed care health plans assisting providers to build Medicaid and the MCOs. I would also like to note that although he's not pictured here, our CEO actually started out as a direct support professional himself, and he worked at all of the different roles at a caregiving agency until becoming CEO. And that agency offered multiple lines of services as well and was in multi-states. He was trying to solve his own pain points of having thousands of employees doing manual processes. So he got together with his friend that worked for IBM for 10 years, and together they designed DCI that is specific to both the caregiving and the fiscal intermediary industries. And so on this next slide, you'll see our mission, vision, and values. I feel we have clearly defined them, and you'll hear them resonate throughout the presentation today. As we really took some time thinking about this, with most of us coming from the provider side, we feel very passionate about what we do. And so our goal is to become your trusted technology partner. So now I'm going to hand it back over to Brian to discuss how a business management platform can help during these times.
Great. Thank you so much, Marisa. We get a number of questions throughout, and one of the biggest ones, how can DCI help us? And the ways that we do that is we track and record time and attendance remotely and accurately. We easily track mileage and client transportation, manage all of your authorizations seamlessly, and have the ability to track the utilization in real time. So you know where that authorization's at, how much is used, and how much is remaining, or if you're over providing. We also capture all the data that you need to pay your employees and bill your funding sources easily and with great accuracy. Some of those additional questions we get when we start talking about, DCI and the training and employee management side is, training our remote employees. How do I even get started with that? Most of our employees are out in the field doing home and community services, or we have a remote program, things like that. So we always like to, talk about that and show you how we're going to educate, train, and keep your staff in compliance using our software. The next one is, how do you keep up with all the compliance items? DCI can track all of your compliance and training items that are required by your funding sources, authorizations, on everything from specific programs, clients, employees, and so on. So we really keep track of any type of compliance and training need within the system, and keep that up to date for you. You know, and how do you make sure that your staff is trained? DCI, we not only track those training and compliance items, but we have a built-in learning management system that works hand in hand with that compliance section, so that we're able to deliver the required training content and even have the ability to take a quiz at the end after each video and ensure your staff has a grasp of the subject at hand and pass the test. After that, our automation kicks in, and we even automatically update the system so that you don't have to worry about your staff doing that. So if the requirement's in the system, they get notified that it's about to expire. A popular one that we always like to use is maybe lift and transfer or bloodborne pathogen, something that has to get done maybe annually or every few years. At that point, it sends out a notification. The employee then clicks on the link, watches the class, takes a quiz at the end, they pass the quiz, the system automatically updates it, so there's no intervention needed. One of the last things we get a lot is how do we easily chat about clients and other sensitive issues without having too many phone calls each day? As we've all transitioned to remote work, we're working from home. As you can see, Marisa and I, we're in our home offices here. So we understand some of the challenges, but it's hard to not just pick up the phone and call folks and wind up being tied up on the phone all day. So what we have in DCI is a secure HIPAA secure notification module that allows for quick and easy messaging and notifications. So it really frees up your time and the time of your employees so that you can get back to caring for clients. I always like to start off with this, and this is what I call our bubble slide. It has all the little bubbles of our core modules within the system. And this really summarizes the magic of DCI. We use integrated processes that work together to improve business outcomes. And you'll see the 6 modules that make up our core system. We'll start off with the Authorizations module. This allows you to track your remaining balances in real time and avoid over and underutilizing your authorizations. We have our Training and Compliance module, which I just talked a little bit about, to track and manage all those employee requirements and compliance items, and gives you that ability to proactively alert employees and supervisors of non-compliance. We have our Scheduling module that allows supervisors to create and publish schedules. Employees can provide availability templates if they have them, and clients can even request specific caregivers and specific schedules. We have our EVV time entry and transportation tracking module that captures all the data necessary to pay your employees for their time and mileage, document their units or time for billing, and meet the requirements of EVV. We have a client ratings module that allows clients to rate their services on a per service basis. The way this works is they receive a notification after service is rendered saying rate your service. You can come as a text or an email. They click on the link, log into DCI, and it gives them a 5-star image. So similar to if you ever taken an Uber and rated your driver afterwards, we click on that, 1 to 5 stars and then put some notes afterwards. This is all confidential within the app that only your administration can see, but it gives you a great way to see how your employees are doing out in the field. So another way that we're doing that, remote management. But it also is great if you ever have to come up with any quality reports over time. The last module that we always like to chat about here is our business rules and approval. This is the area of DCI where your agency defines those configurable settings that set up automated review and, of course, auto approval. And when all these processes work together, the results are billing and payroll files, agency compliance, proactive alerts and notifications, and quality of care analytics. As we move on, I'd like to take a little bit deeper dive into a couple of these modules. And the first one is that authorization module. Really sets DCI apart. We do real-time authorization management in either units, hours, or budget-based. We're capable of importing updates and additions to your authorizations from your funding sources. DCI allows you to manage your start, end, and expiration dates. And we're the system of record for all of your billing and care management transactions. For our training module, really we call this our training and compliance module. And it provides the ability to track training and compliance items on your employees at multiple levels. So we also provide those proactive alerts and notifications to your users and supervisors of any deficiencies or non-compliance to prevent caregivers from providing care they're not certified to perform. And again, we have that learning management system that works hand in hand with our training module that we're going to talk about next. So again, we call this DCI above and beyond. It's really starting how everything plays together. If you have an authorization that requires certain skill set, you put those in the training module that links to that authorization, and then you play the information through our learning management system. So it really all ties together in one seamless approach. We have, if you don't have your own training content, we have a video library of high definition videos that you can rent from us, as well as the ability to load your own trainings, whether it be a PowerPoint, a video presentation. We have folks that still continue to do some live presentations and just have someone record them at the back of the room and then provide that to us along with your quiz. We get that in the system. So there are multiple ways that we can do it, all the way down to true professional videography. We have a company that we work with for that. DCI has real-time alerts, notifications, and messaging. It's all HIPAA secure, and nothing is ever stored on a device, so you don't have to worry about lost devices. This allows your employees to manage themselves, as well as making employee oversight much more simple. I have a screenshot here of DCI's dashboard. With our dashboard, I'm logged in here as a super user. So you see across the top of the screen a number of our modules here. That list at the top is only shows what I have access to, because we do use role-based security. The list on the left-hand side, or that list, changes based on what module you choose. Once you see our mobile app here in a few minutes, you'll be able to go ahead and see how much the two systems really look alike. And that was done on purpose. DCI has the ability to do auto approval. So this lets the majority of your time entries by your employees get auto approved, so your supervisors only have to worry about the punches that require their attention. And I really like this one because this slide says it all. DCI makes your back office easier. You see both payroll and billing on the one screen. That was done to ensure you realize the power of one system that does both. DCI lines up your payroll and billing utilizing your EVV data and the authorization module to generate those payroll and billing output files for you. We can notify you even of certain billing deficiencies through alerting you of any of the following three scenarios. If a punch has gone into overtime, if a punch has gone over the authorization limit, or if a punch is missing the client's signature, helping you identify or correct any issues before they occur. And I have a couple things that I'd like to summarize before we get back and try to do that mobile app for you. As you saw through some of these slides, we can help your organization manage your remote employees during the pandemic, but also after. This sets up your agency to thrive and grow in the future. Our training and compliance module allows you to easily track and educate your staff, whether they're on-site or remote. We automate all of those tasks and training requirements for an organization. That saves you time and money. Automation allows your users to get back to caregiving and reduce the amount of time they spent on administrative tasks. And of course, as always, if you'd like to learn more, if you'd really like to get into a deep discussion with us, we're always available. Feel free to give us a call, 480-295-3307. And give me just a moment. Let me see if I can get the mobile app up on my end, and we can do a quick walkthrough if that works. So we'll see here, we're back to that login screen. I'm going to go ahead and log in for today. I'm going to steal Maurice's login because I know she already has some punches in here for us. And what we can see here is as soon as I clock in, you'll notice that this looks a lot like that screenshot I showed you of our desktop version. So in the mobile app, we have our clock in, our other entries in our drive. We're going to talk about those in just a minute. Right below that, we have what we call our overtime gauge. So you can see it's got a nice speedometer there that shows you how many hours you've worked this week. You can quickly and easily flip weeks back and forth with these arrows, and you see the week that you're looking at. So we're in the green from 0 to 30 hours in the week. 30 to 40 hours gets us in the yellow, and anything that puts us into overtime or over 40 hours goes into the red. So I can quickly and easily see where I'm at for the week, what I've done, and how many hours I've worked. The next section shows a breakdown of those hours. So we have the approved hours. How many hours are approved and going on payroll? How many pending hours? So pending is stuff that is not been approved by my supervisor or by my client. And then unverified hours are those hours that maybe I had to go in and make an edit and it goes back for additional approval. So we can see our total hours. And then the last thing on the bottom is our news post. And our news post is a agency-wide broadcast system that allows you to post things. This has gotten really popular here lately with the whole pandemic. Folks are updating policies pretty regularly on different things that have to do with either COVID or just remote work, office etiquette, things like that. You're able to send out those news posts quickly and easily. To do a clock in, I simply click the clock in button on my app. Now on my tablet, I'll choose the client that I'm working with, and this shows me a list of the clients that I'm authorized to work with. You'll see our developers are big Star Wars fans. So here we have Chewbacca and Jabba the Hutt. We're going to work with Chewbacca for right now. I'm going to hit OK. And you'll see, because I only have one service code that I work with Chewbacca with, it automatically selects my service code for me. But if I had multiple, I'd have the ability to choose it from a drop down, and it also chooses my cost center for me. So we click continue. And at this point, it asks me what EVV location I'll be doing my services from. So I can either choose none or home in this instance, but you can have any number of locations listed. So home, maybe a family member, mom or dad's house, the park, a doctor's office, things like that. So I'm going to choose home and hit OK. And then I'm going to confirm my clock in. Now, mind you, I'm taking a lot of time discussing all this. If I were to go through this in real time, I would already be clocked in and I'd already be off doing some stuff. But we have multiple options for our EVV. So we have a PIN password, where you could actually, at this point, you would choose the PIN password option, hand the device to a client or guardian, and they'd put in their PIN and password. The exact same thing for e-signature. So you choose e-signature and be able to hand it over to the client, and they would sign with their finger or stylus. And we'll do e-signature on the way out so you can see that. And then picture, and that's the one we're going to do right now. So it says DCI would like to access your camera. And this is important because we're not accessing the photos and we're not storing anything on the device. So I'm going to go ahead and hit OK. It's going to access the camera, and I'll turn it around and take a picture of myself. There we go. Not a very good one, but. So after we took that picture, we hit confirm. So yeah, I took a picture of my desk. So I'm not very good at this at all, but you'd be taking a picture of your client. We confirm that. It goes off to the business cloud, and we use artificial intelligence to validate whether that picture is correct or not. So we're now logged in. At this point, I can look at any of my client details, so I can see any care notes that are needed for them. I have a notes section that I can see any prior notes, so maybe from the prior shift, as well as any attachments. At this point, if I want to click on this little plus button on the bottom right, I see I have some additional things. I can add a note. I can add an attachment, which I could take a picture with my camera. So let's say maybe there's an incident report or goal tracking. If I go over goal tracking, it brings me to my goals and tasks. So for Chewbacca, we have the goal of hygiene. So I'll select that, and I can have any number of goals listed here. The tasks for hygiene are brush hair, brush teeth, and bathing. So today we're going to brush hair. This is going to take a while because it's Chewbacca, you know. And then the results are totally customizable. So you get to choose, is it met, not met? Is there a barrier? Did we count the refusals? Or is that not applicable? So we'll just say that we met it. Here I can add any free text notes. So anything that I need to say, Chewbacca did really good today. And then how many prompts did it take? So we did choose one, and again, the ability to add an attachment. You'll see in just about every screen in DCI, we can add attachments, we can add notes. So I'll click save, and now I've added my care notes. So I can see that right here in the list that today at 1:30 p.m., we did the goal of hygiene with a task of brushing hair. If I want to do some client transportation, I can simply choose Start Client Transportation. I hit Continue, and you'll notice that it does show the amount of authorization that's remaining for this. We get a little pop-up saying that, you know, using this, it can deal with the battery a little bit. Then we'll hit Confirm. We use GeoMaps to ping our location. So we can see there I'm at my house. We'll hit OK and confirm. And now we've started client transportation. We'll see the little pin that talks about where we're at here in Jonestown, Texas. So at this point, I could drive. Maybe we were going to the ball game. We drove to the ball game, but I can start and stop client transportation as many times as I need to during the shift. At that point, maybe we've gotten to where we want to go. We'll go ahead and go back and in client transportation now. So we'll hit that. We'll confirm where we're at. Still haven't really moved. And you'll notice on the map here, we drove 0 miles in 0 minutes. So if we were to zoom in here on this map, you can actually see that both pins are there and overlaid. So pin A and B. But because we're kind of zoomed out, we can see, you know, just the one pin there. At this point, it gets to the end of my shift and I'm ready to clock out. We go ahead and hit clock out. At this point, it's going to ask again that same EVV location. Am I still where I'm supposed to be, so that we can check that in the background. Add any notes. Maybe, you know, we went to the ball game. Apologize for my horrific typing. We have the ability to, of course, again, you see where we can add a picture here, or we also have canned statements. So you can have any type canned statements that you want. Some folks like simple objectives here that were met or not met. Some folks want their DSPs to sign off on a statement, such as, you know, I'm validating that I did the things I said in the app today. So we'll just choose our objective. And then we have the option to publish care notes and clock out, or maybe if time got away from me and I didn't get a chance to finish my care notes, but I need to get off the clock, I can clock out without publishing care notes. So we'll just do that because I didn't do all my tasks today. At that point, that gives me asks how I'm going to do my verification. So for this one, we'll do e-signature. I'll hand the device over to my client or guardian, and they can sign with their finger or a stylus. You thought my typing was bad, you should see my signatures. We'll hit confirm, and now that gives me a summary of my shift. So we can see the client I work with is Chewbacca. Their service code was hourly EVV. Clock in time, clock out time, and any notes associated with it. So at that point, I can go back home. You'll see that my overtime gauge moved a little bit. We weren't clocked in very long, but still I went from 0.08 to 0.13, so we're doing pretty good. By the end of the week, I'll have a full couple hours on here. At that point, we can talk about other entries. The other entries button is just that. So it allows for you to put in things such as maybe a group service, training, PTO, admin time, any of those type things. Simply put that in, the date and time that those were done, any notes for that punch, and again, ability to add a picture. The Drive tab is for non-client transportation driving. So think of this as maybe having to run errands. You can designate a personal vehicle or a company vehicle. You can make these payable or not, and billable or not. So at that point, I'd like to also talk about a couple other features in the app. You'll know that I talked about those notifications earlier. If I look at the top right corner, we see that little envelope. When I click on that, that gives me a list of all of my messages. So we can see here that we have some updated policies and procedures due to COVID. I could quickly and easily read that. A punch was rejected. Of course, me sending a test message to Marisa because we don't have anything better to do than send test messages back and forth. And that a CPR certification is expiring. So quickly and easily, everything that I need to know is right at my fingertips. With these messages, they're not only in DCI, but we also send a notification via email or SMS text so that you know that you have a notification that you can click on, get right into DCI, and see what it pertains to. If I go back to my main screen, on the left-hand side, we have our what's called nowadays a hamburger menu or a little menus button. So we can see here we have our home tab. Again, another quick, easy way to get to messaging. I can review my entries, so I can see all of my clock ins and clock outs over the last few weeks. So I can quickly scroll through here, see what are pending, what have been approved, what have been rejected. You know, this can save a lot of time for your supervisors and admin staff. Think about all the phone calls you get, or hey, is that on payroll? What happened to this one? Where's that one at? Quickly and easily, your employees get the power at their fingertips to see what's on the next paycheck, what's been approved, and what's pending. We can see our schedule. So if you're using DCI's scheduling application, we have the ability for you to look at where you're scheduled to be, when, where, and how. So you can see that you're scheduled this week to work with Chewbacca on Sunday for an hourly EVV for 4 hours. We can see on Tuesday the same thing, so anywhere that I'm going to be. We also understand that you share employees across multiple programs. In the doing that, you may not be going to the same place. You may be at a day program one day, you may be working at a residential home the next, and out doing home and community services the following. So you need to know where you're supposed to be, and having that on your mobile app, in your pocket at all times is a quick and easy way. We can see the shifts that you have, what you're scheduled for today, and even any offered shifts. I, of course, don't have any offered shifts right now, but give us a call, and we'd love to expound on all the different ways our scheduling can really help your organization. Our care management, this is great because I can see what active clients I have, when the last time I worked with them, as well as what were my pending care notes and my published care notes. So you can see, because we do a lot of demos in here, we're way behind on our care notes, and we'd probably have our hand slapped if we were doing this for real, but that's okay. We have a search feature that allows you to search anything in the app. So that really is kind of the high level that gets you back to what the DCI app is all about. It's absolutely fantastic. We love what we do with it and how it can save organizations tons of time and energy. At this point, we'll jump back over to our presentation and open it up to any questions that anybody has.
Brian, I do see one question in the Q&A box.
Yep, I just got it open. So the question is, does DCI have a GPS in the vehicles, or do we just use the cell phone's GPS to track agency vehicles? And the answer to that question is we just use the cell phone to track it. We don't do actual GPS, physical GPS in the vehicles, but as long as that device is with them, then we're able to track where that employee is going, whether it be a company vehicle or a personal vehicle. So great, a couple more questions that came in, great. So does the DCI system for time and attendance interface with Paycom? And the answer is absolutely. We work with quite a few different payroll systems out there, Paycom being one of them. Not only do we work with Paycom, ADP, Paychex, and quite a few others, but you know, we're happy to work with anyone that can accept an import. How does EVV work when doing a Zoom meeting with a client? So if you're not in person with the client, you're of course not going to get the GPS or the geolocation data. So there are different ways that we have to go about that. So we have what's called client portal sign-off, where the employee would go into the system and mark the times that they were with that client, and it would go to the client or their guardian to be able to sign off to say, yes, that meeting happened or that service happened. Our next one, does DCI interface with the state SANdata EVV system? We absolutely do. We interface with SANdata in multiple states, Colorado being one of them. We have a number of agencies that we work with in the state of Colorado. We are currently in 29 states across the country, and SANdata's in quite a few of those. So yes, we work with SANdata quite a bit. Great questions. Any other questions? Paylocity too, of course. Paylocity does accept imports, so we do interface with them as well. So wonderful. We'll give it just another second for questions here. And again, I apologize about the technical difficulties in the middle of it. As we all know, you know, with everybody working from home, internet can come in and out at the most unexpected times. So if there are no other questions, I think it's time that we give away a $100 Amazon gift card. So what we have is the ability to randomly generate a name from everyone that was attending today. So Marisa, it looks like you're back. Can you take it away for us?
Yes. So I put in everyone's names, all the attendees, into a name picker. And I am going to go ahead and spin the wheel. I don't know if I should dare try to share my screen with my internet.
Let's not and say we didn't.
Okay. So I'm going to tap spin the wheel. And here it goes.
And Johnny, we'll get to your question as soon as we get this drawing done.
And Jared Cruz, you are the winner. Congratulations, Jared.
Wonderful. Jared, if you could, put in the chat your email address, and we will actually get an Amazon gift card of $100 emailed over to you here in just a few minutes. If you're not on the call, we'll get it from Alliance after the fact. And lastly, we had one more question from Johnny, is do employees actually consent to using their personal cell phones for GPS tracking while driving? And it comes down to your agency and what they, you know, what they require, what they put in the job description. We've had very little to no pushback across the country. It's, you know, you can't look at it as a negative. You have to go with it as a positive light of saying, you know, we really want to make sure that we're paying you for every mile that you're doing. You know, so that's why we want you to use that phone to be able to track that client transportation so that we can ensure we're paying you for every mile that you're driving through this. So I'd love to have a deeper discussion on that too, Johnny. So feel free to reach out to us and let us know, you know, talk you through kind of what we've seen and best case and best practices. Wonderful. Any other questions before we kind of sign off for the day? Wonderful. Well, thank you everyone for your time today. We really appreciate it. We'd love to have a, you know, more in-depth conversation in the future. So feel free to reach out to us. If you don't know how to get us, I know Alliance does. We're always so proud of the events that Alliance puts on throughout the year. and we love being part of this conference every year. So it's really means something to us, and we were glad that we could at least get together virtually since we can't see everyone face to face, and have the fun games and entertainment that we have in Breckenridge. So thank you, everyone. Have a great day, and we really appreciate everything.